Hi, I'm Dr. Mike Milligan. I'm here with Dr. John Flutter, international speaker on breathing from Australia. John, thanks so much for being with us.
My pleasure to be here this afternoon. Thank you.
Great. Well, let's talk about breathing. There's a right way to breathe, which gives you great health, and a wrong way to breathe, which really deteriorates your health. Tell us a little bit about some of the problems with poor breathing. What symptoms can we have with poor breathing?
Well, ideal breathing patterns, optimal breathing, it requires you to breathe through your nose all the time.
Mm-hmm.
And the nose is there for a purpose. The nose is an air conditioner. The nose, if you breathe through the nose, it warms the air, it humidifies the air, and it filters the air. The lungs like to receive warm, clean, moist air. So the first thing it does is physically gives you much better air for your lungs.
Okay.
And so lung infections, tonsillar infections, adenoid infections are much reduced because the nose does the filtration for you. So there's a big area where you have a direct effect within the airway when you breathe through your nose.
So people with tonsils and adenoids inflamed, or asthma symptoms, or things like this, it could just be poor breathing.
Very often it's just poor breathing, yes. And then the other effects that are evident when you do mouth breathing, it has an effect on the blood chemistry.
Right.
And it's a little bit complex, the blood chemistry, but what we need to do if we breathe through our nose is that we build up the necessary store of carbon dioxide in our lungs and in the blood.
Okay.
And the body chemistry requires us to have adequate levels of carbon dioxide in the blood.
Not just oxygen, we also need the carbon dioxide.
We always have plenty of oxygen. As long as you're above water and you have healthy lungs, you're never short of oxygen. The problem is not that you don't have oxygen in the blood, but the oxygen is unable to be released from the blood to the cells where it's needed when the carbon dioxide levels are low.
Okay. And so this causes the muscles not to get enough oxygen, and you get many symptoms from that as well, such as?
Well, it's not just the muscles. All cells of the body get inadequate oxygen. Right. So the most important cells in your body are the brain cells. Right. And mouth breathers get less oxygen to their brain cells, particularly at night. When you go to bed at night and sleep and breathe through your nose and you wake up feeling refreshed and alert and bright, that's because the cells of the brain have actually received better oxygenation during the night.
Right. And as far as the muscles, then you can get bedwetting and other such problems.
Well, the other problem is when you have low carbon dioxide levels in the blood is that smooth muscle in the body goes into spasm. Right. Now we find smooth muscle throughout the body. All the tubes in the body are surrounded by smooth muscle, like in the lungs, like in the blood vessels, like all of your hollow organs. And the tubes through which anything passes, blood, air, urine, water, all of those become smaller. So whatever's supposed to flow down those tubes flows down them less efficiently when you have the spasm in the muscle surrounding those tubes, and you get that with low carbon dioxide. Okay. So these two really significant health effects systemically throughout the body. One is that you get less oxygen to the cells of the body, and the second effect is that the smooth muscle goes into spasm, reducing the flow of whatever's supposed to be flowing down those tubes, air, water, blood. And so you mentioned asthma. While there is such a thing as asthma, many children diagnosed with asthma have asthma symptoms. They have bronchial spasm, that spasm of the smooth muscle within the lung tissue. Okay. And so the lungs shut down.
Also, you can get, through mouth breathing and instead of nose breathing, you get changes in the mouth.
You do get changes
in the
airway.
Mouth. Tell us about that.
Well, one of the problems with mouth breathing is that the tongue is unable to be resting and functioning in the roof of the mouth.
Where it's supposed to be.
Where it's supposed to be. For ideal growth and development of the head, the tongue needs to be up in the roof of the mouth. If the tongue's not in the roof of the mouth, which it can't be if you're mouth breathing, then the development or the growth and development of the face is in a downward direction. Okay. As it grows further downwards, the the airway itself becomes restricted, it becomes narrower as the face falls down and back instead of growing forwards. Also, when you've got a low tongue posture, the width of the upper jaw is reduced. As the width of the upper jaw is reduced, the width of the nasal passages are reduced.
The same bone.
Same bone, separated by just the palate. One bone separates, it's like upstairs, downstairs, upstairs nose, downstairs mouth.
And of course that's the floor of the brain as well. As you expand this, or as you contract this from not breathing through your nose and the tongue being not in the roof of your mouth, well, the cranium gets narrower as well.
The whole cranium. It has an effect throughout the cranium. The bones of the cranium, 29 of them, are all interlinked and joined, and you can't have 2 or 3 bones in the cranium distorted without all of them being distorted. So you see distortions throughout the cranium.
So snoring, sleep apnea, several of those things can be affected as well through the improper breathing through the mouth.
Yes, well, snoring and sleep apnea result from mouth breathing, yes. And so very often you can improve sleep apnea and snoring by establishing nasal breathing.
Right, good. Why is this so prevalent in our society today?
Well, it's so prevalent because most children have their mouths open most of the time.
Yeah.
The muscles that we use to hold our mouths closed are the same muscles we chew with. And what's happened to the diet in the last couple of 100 years?
Very soft.
Softer and softer. So these now, the kids have their mouths open. The jaw drops open, the tongue drops down, and then you don't get the development in the width of the airway.
Right.
So they can't breathe through the nose, so they don't breathe through their nose.
So what do you do? What's the treatment? How do you fix this?
Well, I know this sounds a silly thing to say, but if you want to breathe through your nose, what you have to do is to breathe through your nose. Now, many people come along and say, it's difficult to breathe through my nose. Yes, it's difficult to breathe through your nose because you don't do it. If you want to get good at breathing through your nose, what you have to do is breathe through your nose. And we have programs to help children learn to breathe through their nose all night, and we wear appliances like the Maya brace that will ensure that you breathe through your nose all night, which is a really important thing for your health and for the growth and development of the cranium.
So really, to get this corrected, you're going to need to improve your arch form so that you can get your tongue to the roof of your mouth and your lips together.
Well,
you're going to need to breathe correctly and learn how to breathe correctly. Posture is a part of that. Can you tell us a little bit about those things?
Yes, well, if the children are young, then the tongue alone can do the development of the upper jaw.
Right.
And that's what nature does for you. The upper jaw grows and develops as the tongue grows and develops. If you're 8, 9, 10 years of age or older and you've got a narrow upper jaw, the tongue by itself won't do that development for you.
Okay.
So in those cases, that's where you have to start to develop the jaw.
Right, a dentist would develop
And a dentist can do that, make the upper jaw bigger to make room for the tongue to go in the roof of the mouth, to increase the width of the upper jaw, to increase the nasal passages, to improve that. And at the same time, when you increase the width of the jaw, the upper jaw comes forwards, giving you a greater space in the pharyngeal airway. That's the airway behind the mouth. And you're getting that bigger. All of that facilitates a bigger nasal airway to make it easier to establish nasal breathing.
Okay, and then to get that breathing better, what do you do?
Well,
Once you've got the anatomy that you can.
Well, then you've got to do a few things. Most children need to slow their breathing down. And the reason that children hyperventilate very often is because they don't breathe using their diaphragm.
Okay.
And so if they don't breathe from their diaphragm, what they're using is their chest and their shoulders to breathe with. They've got a posture where they're sitting forward or standing forwards, and this part of the body, the diaphragm, is locked up. So they're breathing from the chest and the shoulders, then they're only ventilating a part of the lungs. Because you're only ventilating a part of the lungs, the child has to hyperventilate. They'll breathe 25, 30 breaths a minute whereas they're normally breathing 8 to 12 breaths a minute. So it's really difficult breathing 30 breaths a minute through your nose. So you have to slow the breathing down, and part of that is learning to sit up straight, stand up straight, and use your diaphragm. So posture and breathing go hand in hand.
Okay, well, very good. So what's the best time to treat?
The younger the better. The easier, it's much easier to change patterns the younger the children are. The challenge is to get compliance with younger children. But when mums ask me when's the best time, what I say is grade 1, when the children have got their first new teeth coming through, about age 6, about grade 1. That I think is an ideal age when they've got the understanding of what to do, but they've still got a lot of growth and development in front of them.
Okay, so 6 to 8 is the best time to treat. 8 to 12 might be the next best, and just the sooner the better.
The sooner the better, yeah,
Okay.
yeah.
And the big benefits of treatment would be?
Well, breathing through the nose gives you a big improvement in your general health. The normal human physiological pattern is breathing through the nose. The body chemistry, the body physiology works best when you breathe through your nose. In addition to that, you'll get well-developed jaws, straight teeth, and more attractive faces.
Right, absolutely. Is there anything else you'd like to tell us before we close?
Well, breathing is becoming increasingly more important. More and more healthcare practitioners are becoming aware of the importance of breathing. Breathing in ancient times has always been important. At the top of the health totem always was breathing. This has been known from ancient Chinese medicine times. They've known that breathing was at the peak of the totem.
Right.
To breathe is to live.
Okay. What about extracting teeth for braces? And that would actually bring the jaws back some.
Well, anything that reduces the size of the upper jaw reduces the size of the nasal airway. Anything that pulls the upper jaw back reduces the size of the pharyngeal airway. Both of these things tend to happen when you use extractions and headgear to straighten or align teeth.
What about taping your mouth closed? I know a lot of people, you and myself included, tape our mouths closed at night, and that's a strange thing for many of the viewers here.
Yes, taping the mouth at night, I have to stress, doesn't prevent you from opening your mouth. What it does is to remind you to keep your mouth closed. And if you breathe through your nose all night, which you will if you tape your lips, just with paper tape. I'm not talking about putting duct tape around your head like this, just a small bit of paper tape across your lips. You'll breathe through your nose all night. And if you do that, you'll immediately find the benefits of doing that.
Right, absolutely. Where do we get more information, John?
Well, there's more information on my website. I've got a very large section on my website on breathing, but there's lots of information on the website if you choose to, on the internet in general. My website is jfdental.com.au.
Dr. Flutter, thanks so much for being with us.
My pleasure. Thank you.